still ask us, even in 2025, what is a dental implant? When we think of implants, we all think breast implants. You know? That's the number one thing, isn't it? That's what everyone's. But what is a dental implant?
Well, we always get that question, don't we?
First podcast, here we go. How's your day?
Yeah, it's good. Busy.
Good.
Busy. Good busy.
Yeah.
Kept on time, which was nice.
Yeah, I was mentoring all day, so it was a nice day just watching people do implants.
Every time I saw you, you had a different book in your hand, walking around.
I'm into my reading now. I think it's just I'm a changed man, so no, I do enjoy reading. So podcast, here we go. Shall we start? Yeah.
Let's do this.
So welcome to the Abbey House Dental Podcast. The first podcast we wanted to introduce Dr Jas Poonian. Jas has been with us since 2020, and in that time he's known at the practice of being the main implantologist at the Stone site and does cosmetic, sedation and some of the bigger dental cases at the practice. We wanted to really talk firstly, Jas, about your career and what made you want to do dentistry. And then moving on to what made you want to do implants.
Thank you, Amit, for the opportunity for me to speak on the podcast. My journey initially started, I graduated from Birmingham University in 2013, not really knowing sort of what trajectory of dentistry I wanted to do, and I went into general practice. Through that, I spent the next 5 to 6 years within Staffordshire, working in predominantly sort of NHS practices, and I learnt a lot and got to meet some amazing people and worked with some fantastic dentists. And then my brother needed an implant.
Oh, I remember, yes, yeah.
I'm sure he won't mind me saying this. But he needed a dental implant, and our good friend Satnam Verdi and colleague Satnam Verdi, he recommended you.
Yeah.
And I remember coming to the practice. It was back on 9 Abbey Street, the original building, and I went there sort of as a chaperone to my brother for the consultation. I think you took the tooth out on that day. I can't remember exactly. And unbeknownst to me, it was the first time I met you, and I think it was a bit of a dental interview, to be honest. You were asking me all these questions about what I'd done, what courses I'd been on, where I see myself in 5 years. I was like, I'm here on a Saturday just with my brother.
Well, funny enough, I was quite nervous about that case because one, your brother's a GP.
Yeah.
You're a dentist. Your sister's a dentist.
Yeah.
So the pressure was on, wasn't it, to perform? So, but then I realised your potential, and I just did want to make that kind of conversation with you to see whether we could encourage you to join the team.
Yeah, then a few months later the phone call, and the rest is history. But I think 2020 was a strange year. COVID had happened that year as well, so it was, I think, a reset. And I know people use that a lot, but it was a general reset for me and my family as to where I see myself in terms of clinical dentistry in the future and where I see my potential. But none of that is done if you're by yourself. You have to have the team behind you in order to reach the sort of heights that you can. And I think definitely when I came to Abbey House, that was the case. From the push clinically from yourself, with especially regards to the implant side of things. I remember with Invisalign as well, Mumta helped a lot initially. Smile makeover cases. We've changed a lot of lives together as a practice, as a team, and I can say that is all down to, I think, making that move in the right direction back in 2020.
Yeah.
Who would have thought it from that moment?
And then kind of moving on from that, so you've been with us 5 years now. You kind of started off as an NHS dentist at the practice, and then you had taken on more stations, more implants, more smart makeovers. Like you said, the Invisalign was, you're doing quite a lot of that. What's made you focus over the last 5 years into doing dental implants, and why do you enjoy doing that treatment?
Essentially, I think it's the challenge of replacing something that's been lost. And, implants isn't always for everybody. We know that. Sometimes there are alternative options that are better for the patient. And we have that conversation a lot of the time. Having said that, with dental implants, you're giving the patient the opportunity to eat and chew and smile, confidence, and that is difficult to replicate in other aspects of dentistry. Having done a lot of that general dentistry in the past, you don't get that same gratitude and end result that you do with implants, especially. I think it's the challenge aspect as well to it is quite unique. It's tough.
Yeah.
And if you don't plan correctly and you don't know what you're doing, you can get into trouble. What we do here is the meticulous planning really helps us. We go through cases together as a team, and that way, we can prevent any potential risk by good planning and good application.
So, it takes me back, but when I trained in implants around probably 2012, in those days there wasn't many people doing dental implants. So when we were offering this treatment, it was genuinely, a lot of people had never heard of it or never had it, and so we were doing a lot more in those days to people that had never heard of the treatment. Now, you can see that so many different practices offer dental implants, so many local practices. What would you say is different about what we do here, and what is different about your training specifically?
I think, specifically to me, I think I'm part of the generation that is a little bit analog and a little bit digital. Okay, when I say that, there's analog, which is old school impressions, taking putty impressions, and then there's new school digital, which is taking scans of everything. And I think it's important to know when to use different methods. With that in mind, sometimes an impression or an old school technique is better than doing something completely digital. And I think that is the unique sort of sides of my generation of dentist. Moving forward in regards to what we do at Abbey House, we have the treatment coordinators who are fantastic and essential to what we do. From the first moment the patient walks through the doors, they're greeted by such friendly faces. We scan in terms of intraoral scanning for each appointment at every stage. That ensures that we're on top of all stages of treatment so that we don't miss anything. And then with that, we've got that digital footprint moving forwards as well, so that we can plan each case, place the implant in the correct position digitally, bearing in mind the tooth shape and position from the beginning.
Yeah.
And that's the key to success for your implant long term. And also we've got the team to maintain as well. So I know once the patient's had their implant placed here, with the maintenance as well that we can offer, it's a win-win situation for the patient.
But in terms of going into the training part, I know there's so many implant courses that a lot of dentists do that kind of are a weekend course or a year course. What I would say that's different about us, and hopefully you agree with me, is that the training that we do as implantologists at Abbey House Dental is extensive. We've travelled the world learning implant courses. We've been doing it a long time. There's so many of us within the practice that do implants that we've all been on different courses, so we bring that kind of experience all in one roof. And we've got a good reputation. We do so many implants in Stone, usually Stafford, and the Stoke-on-Trent practice. What would you say is different about your training that you've been through specifically compared to some of the other guys within the practice and locally?
I think generally what I enjoy is as I said earlier, the challenge aspect of it. One thing when you lose a tooth, you lose bone a lot of the time. And then when you lose bone, you've got to build that bone majority of the time as well in order for the implant to be successful. So I think my general look at dentistry is very risk averse, and how can I limit risk for the patient long term? And that's how that's my mantra in a way, and how I approach dentistry. So if I look at a CT scan, and a CT scan is an X-ray that shows you obviously the width and the depth of bone in order for us to place an implant. If I look at that and I can't safely place an implant without a bone graft, that conversation is done on the same day as the CT scan, which is normally at the same time first meeting the patient. And I think going back to my training, a heavy influence has been on the foundations of the bone that's there. If we haven't got good foundation of the bone that's there, modify it, build it up so that we can place the adequate and the right implant for that patient in the right space. And then from there, everything then is just set in motion, and it's a lot easier and a lot more predictable for the patient as well.
You can just see the passion coming out, when you're talking about all of this, and you can see why you have kind of guided your career towards moving into just doing implants. Another thing that kind of wanted to kind of elaborate on, which I think patients still ask us, even in 2025, what is a dental implant? When we think of implants, we all think breast implants. That's the number one thing, isn't it? That's what everyone's. But what is a dental implant?
Well, we always get that question, don't we? Oh, you're going to put the screw in and put it into my... But yeah, it is. It's not quite going to B&Q or going to Screwfix and picking up a screw from there, but it's a specialised implant, kind of with a screw type thread to it, which goes into your jawbone. Majority of the time they're made out of titanium. There are other materials out there as well these days. And effectively what that does is, the research has shown that bone just forms naturally over a period of time around that implant. That's the key. If that bone doesn't form around it, then the implant's not going to stay in. Okay, and that can sometimes take months and months and months before we're able to give you the actual finished tooth or the crown, implant crown, over the top of the implant. That's effectively it. Sometimes we have to add bone prior to or on the day of placing the implant. Sometimes we have to build up the gum as well, So there's a lot of aspects to it, but that's essentially it. The titanium screw goes into the bone, and then that's got to heal. A couple of months later, we can give you the tooth.
And why would I, let's just say, as a patient, why would I need a dental implant? When would I need that?
You lose your front tooth, what options do you have? If I said to you, Amit, you've lost your front tooth, you have to live like that forever. You happy with that?
Yeah.
Is that good?
I wouldn't like that, no.
So you've got other options. You've got the denture, and dentures unfortunately can move, can affect your speech. You've got bridge options, and they can affect the teeth neighbouring the gap. Or then you've got the option of a dental implant, which is the closest thing to what you've lost, which is a single sort of tooth. And then on top of that, you've got then multiple teeth. You've got also full arch dentistry, giving a patient an opportunity to have the smile from when they were in their 20s, over not really looking after their teeth, or some people couldn't look after their teeth when they wanted to, and then they've deteriorated, and then when they really do start looking after them, the damage has already happened. We see that all the time.
Yeah.
We see it all the time where patients have lost their confidence, lost their self-esteem, lost who they are. And what we're trying to do is give a little bit of that back to them.
It takes me back to one of my first ever cases. It was a lady that, and you've probably had this so many times with patients, where they bring a bag of dentures, and they've said, I've been to this practice and I've been to that practice, and the dentist has made this denture and this denture, and they've tried every single method of trying to get these dentures to hold in.
Yeah.
And you put that denture in and you can just see it's moving around, because there's no bone at all to kind of hold that denture or give it any form of suction. And I remember all we did, very, very simple treatment for the patient, because she was elderly. We put 2 implants in the lower jaw, and we then used one of her old dentures that fitted well and connected it onto the implants. And just doing that one move, she could suddenly eat most foods. And then she came back once things had healed, and we then made her a new denture that gave her the aesthetics and the look that she wanted. And it was life-changing for her because she could not eat an apple. She could not eat steak. There were so many things that she could suddenly eat that just changed the game for her. And it was not complicated treatment.
And I think that's an example of, reflecting, pausing and that moment and thinking, okay, I've really impacted on that patient's life for the better. And that's why, going back to your question earlier, why do I like to do dental implants? There you go. Yeah. That's your answer.
Another question that we always get is this implant going to last forever? Can it last forever? How would you answer that?
I mean, I would love it to last forever, wouldn't we? But we'd love our teeth to last forever as well. And unfortunately, if the teeth haven't lasted, an implant is only mimicking what a tooth is. A tooth is designed specifically to be in your mouth. And if you've lost that through damage, through gum disease, decay, and obviously an implant can't decay, no, but it can get gum disease around it, that is a real factor. Obviously, with good planning, good implant placement with a good implant crown over the top, and then following a strict maintenance regime, it can last as long as we can make it last, and that can be a long, long time. But having said that, there are so many patient factors. Smoking, diet, alcohol, even medical histories as well.
Yeah.
So quite often, if a patient is maybe type 2 diabetic or a heavy smoker, we may decide to still place the implant, but we know there's a higher risk of potential failures. So we may just wait a little longer before we give them the tooth, so that we know that the implant's just healed a little longer. That can help.
And in terms of the materials, so you mentioned that the dental implant's made out of titanium. What have you found in terms of technology over the years has improved in terms of the materials that we're using in the implant world and the equipment? Why is implant dentistry now more achievable for any patient?
I think a lot of it is down to the research, and that these implants have been around for a long, long, long time, especially the implants that we use as well. We use implants that have been around for decades, right? And the great thing about that is that if, for example, we place an implant from 5-10 years ago, we've still got the equipment that still fits and works with an implant should we need to go there. I mean, the titanium that we use these days is super, super strong titanium, and designed specifically for high bite loading, or if we haven't got that magical bone that we need, we can place a slightly thinner implant and it's still a strong implant as well, preventing it from potential fracture in the future. I think generally where technology is going now is we're definitely in the digital age. I mean, we all know that, and it's been like that possibly for the last 4 or 5 years.
Yeah.
Everyone's going into that direction. And what's interesting now is the whole AI influence on everything in life. Whether you're an accountant or you're a lawyer or you're a teacher, I'm sure everyone's using some form of AI. And the sort of hot topic that we're talking about now is AI in dentistry, and how can we utilize that, or should it be utilized? It's a difficult one, but I know a lot of companies and a lot of people are moving towards sort of AI when it comes to looking at X-rays, making sure that we don't miss anything, or just a second opinion on the X-ray. I think that's worthwhile.
Yeah.
But one of the great things that we've used, and one of the great tools that we've used recently, is we're able to show a patient pretty much instantly from a photo their smile. And then not just their smile in a photo, but somehow, and I don't know how AI does this, but it creates that photo is now a video with then a mock-up of a potential smile makeover. That is...
I love that.
It blew my mind away when I first saw it a couple of months ago. And the amount of patients I've shown since, it's just revolutionised everything we do.
Yeah, I remember when I trained, when we wanted to show a patient how their teeth could look, we would get the lab to make a mock-up of it on a model.
And how long would that take?
And that would take a couple of weeks, and then I'd show the patient the model and say, this is what your teeth could look like. And as much as I thought it looked good, they couldn't really visualise what that looks in their mouth. I think now with the technology, with the AI, with the scanning, you can literally have that patient's face with the smile that they're going to have, and they can see what they look like.
Phenomenal.
And I think, you know, that technology and that visual view of what they're going to look like, I just think makes that decision making a lot easier.
It is, and ultimately we're still in charge of it and we're still in control, and that's what we don't want to lose as well. So AI is fantastic in showing patients the potential of their smile and their teeth, but that's still with our direction, which is important. You know, you can't lose control over cases to artificial intelligence.
Yes, I mean, you know, we were talking about the different materials as well. When I started to do implant work many years ago, the crowns that we used to use were made out of a porcelain and a metal. And so over the years, they were chipping and breaking over time because of how much force is going on it. Now that all of our implants are now fitted with zirconia crowns, which is a super strong material, I think all of us are a lot more confident now that these do last a lot longer.
No doubt. I think with that as well, and I forgot to mention, the older implants would have been cement retained as well, right? So they would have had a layer of cement that you would have cemented over the top of the implant. Nowadays, to avoid that cement causing irritation to the implant, potential gum disease around the implant, we use screw retained. You know, 95% of our cases are screw retained crowns, which again just makes the process so much nicer for the patient. It just screws into the implant, and it's solid.
So where do you see the implant model going in 5 years? What do you think is going to come out? What have you seen that you think is going to improve that patient journey and that patient outcome?
I think we've already alluded to the AI phenomenon, and I think that's the whole world sort of adjusting to that. So I definitely think that's going to have a massive mark on dentistry. In regards to other aspects of implant dentistry that I've seen, there's the digital smile design. Again, that's a lot of AI coming through with that as well, which has revolutionized how patients can see what their face look like with just a single gap being closed with a tooth. There was a lot of potential about implant guided systems, but I haven't seen much movement in that direction, because I think at the end of the day you still need the dentist at the end of the surgical drill to be placing the implant, and I don't think we're quite into the whole robotics of things at this stage. So I certainly don't think we need to talk about that and give anyone ideas to have to
Well, talking about that, so when me and Mumta went to Cologne.
Is that the new dentist starting as a robot? Is that what it is?
We're replacing me with a robot, Jas, that's the new news. But yeah, so when we went to Cologne, they had a robot that was placing an implant on a pretend patient, and they were kind of showcasing that, and a lot of us shot videos on it because we were so amazed, and that was a year ago. And I think in America now they've got that happening as a system, so you don't know. I think everybody previously thought that dentists couldn't be replaced, but there's certain aspects that we're seeing within our profession that robots potentially could do certain procedures that we potentially were doing.
I don't know. I think we have to put it out to the patients.
Yeah.
We'll have to ask our patients, would you rather...
do you want Amit to see you, or do you want robot Amit to see you?
Oh, no, I don't know. We'll have to see. Watch this space. But
and what does life look like for Jas in the next 5 years?
I'm really enjoying what I'm doing. You know, the implant side of things, and with also the general aspect. And what I love to see is, I love to see my patients grow in confidence. I love to see my patients thrive in the practice and feel welcome here. But I also love to see new patients have a look at their x-rays and just help them diagnose what their problems are and help them through those issues that they're having, but also help them with issues that they don't know they've got. And so 5 years time, where do I see myself? Just really thoroughly enjoying what I'm doing, maybe increasing the complexity with the work that I'm doing as well. And yeah, the sky's the limit really. When you've got a good team behind you, there's not much you can do.
I think one of the skills that I've noticed is that you've already started to do some teaching and some mentoring to some of the other implant surgeons, and you're very good at it. You're so good. You're a good teacher, and I do see that in the future we're going to see more of Jas teaching and lecturing.
Sounds good. Sounds like I have to do a bit of reading. I feel like I'll have to get the textbooks out again. But that's always something that I have a passion for.
Yeah.
What's the point of having knowledge without sharing it with your colleagues? And I think we're also close at Abbey House as well. That more than happy to. We're always discussing cases at lunchtime. Nurses always look at us, because these geeks, just have lunch now. But we're always discussing cases, and we love to do it because we love dentistry.
Well, I think that's the end of our first podcast. I just wanted to thank you. Thank you so much for being part of it. I've really enjoyed it. I think we've had lots to discuss, and I'm looking forward to part 2 of our discussion, where we suddenly start talking about a few more implant-related treatments.